So now coming to the role of aspirin and the acid-base balance. So whenever aspirin is used in the therapeutic doses, not very much higher doses, so this aspirin causes the uncoupling of the oxidative phosphorylation. So whenever oxidative phosphorylation is uncoupled, so there is decreased production of the ATP. And due to the decreased production, there is compensatory increase in the respiratory rate to provide more oxygen and to produce more ATP. Due to increased respiration, there will be increased excretion of the carbon dioxide to the outside environment, and there will be decreased the partial pressure of the carbon dioxide. As we know that carbon dioxide is acidic, so by increasing respiration and increasing the CO2 excretion, we are losing the acid. So there will be a respiratory alkalosis, which is compensated by the loss of the bicarbonate excretion. So in therapeutic doses, the aspirin causes respiratory alkalosis. But in higher doses, like the toxic doses, when aspirin is used, it causes respiratory center depression. And when respiratory center is depressed, there will be decreased the breathing rate, so CO2 will accumulate. CO2 will accumulate and CO2 is acidic, so it will cause acidosis. So in the toxic doses, the aspirin causes acidosis, and therapeutic doses, the aspirin causes alkalosis. The next one is the effect on the gastrointestinal tract. As we know this, prostaglandin has a role in decreasing the HCl secretion, and so it is a protective mechanism. But when we give aspirin to a patient, it will decrease the amount of the prostaglandins, so increasing the hydrochloric acid and increasing the chances of ulcers. Moreover, the aspirin can also activate the chemoreceptor trigger zone, which will stimulate the nausea and vomiting. The next one is the CVS effect. So when these drugs are used for a very long time, basically they cause the sodium and water retention, which may causes volume overload, increasing the volume of the extracellular fluid, which can worsen the congestive cardiac failure. Coming to the effect of the aspirin on the uric acid secretion. So in the therapeutic doses, when aspirin is used, so it causes the decrease in the tubular secretion of the uric acid. So whenever this is decreased, so there will be increased levels of the uric acid in the blood. So whenever this is increased, and we already know that in gout patient already uric acid level is increased, so these drugs are not good for the uric acid patient or for the gout patient. In higher doses, when aspirin is used, it causes decrease in the reabsorption. Now coming toward the pharmacokinetics of the aspirin, so it is rapidly absorbed, it is distributed widely in the body, and it has a high protein bound capacity, so it can displace other drugs from the proteins and causes the increase in the blood concentration of those drugs like warfarin. It is metabolized by glucuronide conjugation. And note that in the low doses, it follows the first order kinetics, means a constant friction of the drug is excreted, but in the high doses, it follows the second order kinetics.